Usually, a medical diagnosis is visually precise. Like you
Right.
break your arm, the x-ray shows a jagged white line, and the doctor says, there it is.
Right, it's very definitive.
Exactly. It's comforting to have things neatly categorized like that.
Yeah.
But when a giant breed dog, like a Newfoundland, enters its senior years, that precision it vanishes.
It really does.
You are no longer looking for a flashing red light. You're looking for, a slight change in the shadows.
Yeah, it's a completely different language of observation.
It is.
Mm.
And today, our mission in this deep dive is to decode those hidden signs of aging beneath a massive coat. We want to figure out how to engineer an environment where a gentle giant can succeed long before they ever start to struggle.
And just to set the baseline before we dig into the physiology here, it is important to note this deep dive is strictly an educational analysis of the source material.
Right, of course.
We're unpacking the biology of aging today, but any specific health concerns you observe in your own dog always require a veterinarian's direct assessment.
Absolutely. Okay, let's unpack this idea of an invisible transition. With giant breeds, aging isn't marked by a single birthday.
No, not at all.
A Newfoundland doesn't hit, like, age 7 and suddenly look like a senior dog.
Yeah.
They retain that soft expression, the quiet devotion, and obviously that enormous, impressive double coat.
The visual cues humans usually rely on, like severe graying or physical frailty, are just completely masked by all that fur.
And the timeline itself is a moving target, right?
Exactly. The onset of the senior phase hinges on so many variables, things like lifelong weight management, genetic predispositions, their baseline cardiovascular activity.
Even their teeth, right? That
Yeah.
chronic dental health.
Yes, dental health is a huge factor. A dog carrying an extra 15 pounds, their whole life is going to hit that wall mechanically much faster than a lean dog.
Makes sense.
So there is no universal age bracket where you suddenly flip a switch and declare them a senior.
Okay, let's unpack this with a cleaner analogy. It's less about a dashboard warning light on a car and more like evaluating the structural integrity of a heavily insulated house.
Oh, I like that.
Right. The massive size and dense coat act like thick insulation hiding the load-bearing walls. From the outside, the house looks identical to how it looks 5 years ago.
But behind the drywall,
Exactly. Behind the drywall, the framing might be bowing under the weight.
what's fascinating here is that the insulation, the coat, and the inherent stoicism of the breed, it forces us to shift our entire diagnostic approach.
How so?
Well, think about a lean, short-haired breed like a greyhound. If a greyhound loses a pound of muscle mass in their hindquarters, the atrophy is visually undeniable. You see it immediately.
Right, because there's nothing hiding it.
Exactly. But in a Newfoundland, you could lose 5 pounds of muscle and the coat drapes over the deficit perfectly.
Wow, 5 pounds.
Easily. We cannot wait for obvious visual signs of decline because by the time they are visible through the coat, the structural compromise is already severe.
Stiff look for something else.
We have to train ourselves to look for kinetic changes instead.
Which means we are forced to observe how they move through space. The first indicator isn't how they look, it's the slight kinetic hesitation,
Spot on.
like a rise from the hardwood floor that takes one additional beat, or a pause at the bottom of the porch stairs that just wasn't there last summer.
Or you walk in the door, the tail wags with the usual enthusiasm, but it takes an extra second for the hips to align and follow the movement.
Yeah, those micro-hesitations. But wait, aren't those micro-hesitations just the dog's body entering a silent negotiation with pain?
That's exactly what it is. And our instinct as humans is often to stop their exercise to protect them. But the source material is emphatic here. Exercise must adapt, not cease.
But to adapt it, we have to recognize what we're actually seeing.
Right. It manifests as a shortened stride, stiffness specifically after resting, or a newfound clumsiness, like slipping where they used to walk confidently.
You might also notice they become unusually quiet, overly clingy, or even irritable when touched along the spine.
Yeah, that irritability is a big tell.
I want to challenge this framing for a minute, though, because, slowing down is a biological reality of getting older for any mammal.
Sure.
Why are we pathologizing a shortened stride or a minor hesitation at the stairs? Like, if I'm a little stiff getting out of bed on a cold morning, I don't treat it as a medical crisis, it's just aging.
I get that. It is really tempting to map our own benign aging experiences onto them, but giant breeds are inherently stoic.
Right, they don't complain.
They were bred to endure harsh conditions without complaint. So when a Newfoundland actually alters its gait, when it physically shortens a stride, it isn't just feeling a little stiff.
What is it then?
The shortened stride is a mechanical compensation to reduce the load on a degrading joint. It is a protective measure against active, ongoing pain.
Oh, wow.
Yeah.
Mm.
As a one-off event, maybe they just slept wrong. But as a pattern, a shortened stride is a massive red flag. It warrants a veterinary workup to manage the pain, not just a casual dismissal of, oh, he's just getting old.
That makes total sense.
Yeah.
So I imagine swimming is the ultimate workaround here.
It can be.
Because you take a massive, heavy dog, you put them in the water, and suddenly gravity isn't an issue. You can maintain their cardiovascular health without grinding down their joints, which ties perfectly into their history as water rescue dogs.
In theory, yes. The buoyancy is fantastic for offloading the joints. The danger isn't the swimming itself, it's the physics of the shoreline.
Wait, the shoreline?
Yeah, the entry and exit points are where the catastrophic injuries occur. Hauling a wet, exhausted, 130-pound body up a muddy embankment or a slippery boat ramp requires explosive muscle power.
Oh, I didn't even think about that.
Right. And a senior dog's fast-twitch muscle fibers are degraded. They slip, they overcompensate, and suddenly they tear a cruciate ligament.
So what do owners do?
Handlers have to seek out zero-entry, flat water access. They have to monitor the dog intensely because stamina drops precipitously. And they have to be hypervigilant about cold water temperatures.
Not to mention the post-swim requirement of aggressively drying that double coat, right?
Exactly. If you don't, that trapped moisture can destroy the skin microbiome.
Which introduces an entirely different challenge. We aren't just modifying their interaction with the ground and water. We have to radically shift how we manage their exposure to the weather.
Yeah, the elements stop being just atmospheric conditions and become active health threats.
Heat, especially, is incredibly dangerous for an aging giant breed. And I guess it just comes down to basic thermodynamics.
It does. A Newfoundland has a massive volume to surface area ratio. As they age, their cardiovascular fitness naturally declines.
And their internal cooling systems too, right? Like panting and vasodilation.
Yes, vasodilation, where blood vessels expand to release heat, becomes drastically less efficient. They simply cannot offload heat fast enough.
The guide outlines some pretty severe warning signs for this. Excessive panting that won't resolve even after moving indoors. Physical weakness. Heavy, ropey drooling, vomiting, or confusion.
Those are all major red flags.
Those indicate that the core temperature is rising to a critical point where cellular damage begins. That means air conditioning and deep shade are non-negotiable requirements, not luxuries.
Absolutely. Heat exhaustion can cascade into organ failure rapidly in these dogs, but the inverse is where people often get blindsided.
Their vulnerability to the cold.
Yes.
Here's where it gets really interesting. Because people assume, the defining characteristic of the Newfoundland is its ability to plunge into the freezing Atlantic Ocean to rescue fishermen.
Right.
They're practically synonymous with cold water invincibility. Why does that superpower suddenly evaporate in their senior years?
If we look at the canine physiology driving that superpower, a dog's internal furnace is powered by muscle mass and physical mobility.
Okay.
Muscle tissue generates heat, especially when in active motion. In a senior dog, you have a convergence of issues. The muscle mass wastes away, the joints stiffen so they move less, and the fat layer under the skin often thins out.
So they just can't keep themselves warm.
Exactly. When you remove the muscle density and the kinetic energy, the genetic design of the coat isn't enough to compensate. They literally lose their internal furnace.
So a damp, cold day isn't just uncomfortable for them. It seeps directly into their compromised joints, exacerbating arthritis and stiffness because they can't generate the internal heat to push the cold back out.
Right. They need dry, warm bedding and absolute protection from lying on damp ground.
And the only barrier they have left against those temperature swings is the structural integrity of their coat, which makes hands-on grooming an entirely different discipline for a senior dog.
Oh, grooming transitions from basic hygiene into a mandatory diagnostic procedure. But we really have to adapt the approach.
Like breaking it up.
Yeah. If standing for 45 minutes creates unbearable joint shear, you break it into 10-minute sessions while they lie down. The consistency is what matters, because ignoring the coat leads to compounding physical failures.
For advanced audience, we know mats aren't just aesthetic issues. A severe mat acts as a tourniquet on the skin.
It does.
Yeah.
It physically alters the dog's biomechanics because they will literally change their stride to avoid pulling the tight skin around a matted shoulder.
That's wild. Furthermore, a neglected double coat traps dead undercoat, which holds moisture against the skin.
And that creates the perfect anaerobic environment for acute moist dermatitis.
What we call hotspots.
Exactly. A hotspot is a rapidly spreading bacterial infection that causes agonizing pain. And the scariest part is it can stay completely hidden under the top coat until it's massive.
So our hands are essentially acting as the X-ray machine. While we're parting the hair to check the skin microbiome and look for hidden lumps, we're also running a tactile body condition score.
Trusting your hands is infinitely more reliable than trusting your eyes. As a giant breed's activity drops, they often gain weight, adding massive strain to failing joints.
Or they go the other way, right?
Right. Alternatively, they experience cachexia.
Cachexia.
Yeah, muscle wasting. It's where the body consumes its own muscle for energy. You have to physically press through the coat to palpate the shoulder blades, the spine, the ribs, and the thigh muscles. You have to feel if the framing of the house is holding up.
The guide also points out a behavioral red flag during this process. If a dog who historically tolerated or even loved grooming suddenly pulls away or growls when you brush a specific area, they aren't just being stubborn.
No, they are localized flinching from pain.
It is a critical data point. And while we are conducting this physical exam, we have to look at the hidden mouth.
The mouth is so important.
Bad breath in a senior dog is frequently written off as an unavoidable nuisance of aging, but it is actually a primary indicator of systemic trouble.
We are looking at referred pain and systemic loading here. Plaque and tartar buildup causing periodontal disease. That inflammation doesn't just stay in the gums.
Right, bacteria enter the bloodstream.
Exactly. It constantly taxes the dog's immune system, their heart valves, and their kidneys. And beyond the systemic load, the localized pain is just agonizing.
Which fundamentally alters their behavior. You will see them dropping kibble, or chewing exclusively on one side of their mouth, or intensely pawing at their muzzle.
Or showing a sudden preference for soft food.
The guide drives this point home. If a giant breed suddenly loses its appetite, it is incredibly rare that they have just decided to become a picky eater.
Sudden appetite loss in these breeds is a glaring alarm bell. It almost always points to severe dental pain, making it too agonizing to chew, or underlying systemic nausea.
Again, the stoicism works against us. They won't cry in pain, they simply stop eating.
Exactly.
But even the most thorough, physical, hands-on exam has its limits. I mean, your hands can tell you about muscle wasting or a painful tooth, but they can't feel a dog's peripheral vision fading.
No, they can't.
Or their heart struggling to pump efficiently. That requires a completely different kind of observation.
When we monitor internal organ function, particularly the heart and lungs, the margin for error is razor thin.
What should people be looking for?
If a senior giant breed begins coughing, particularly a dry, hacking cough when resting, or if they experience fainting spells, sudden weakness on a short walk, or collapse, those are critical events.
A failing heart struggles to oxygenate the massive body, leading to fluid buildup in the lungs or sudden drops in blood pressure.
Right. These symptoms demand immediate veterinary intervention. You can't just wait and see.
And then there's the sensory softening, which is much stealthier. You might walk up behind them to give them a pet, and they startle violently.
Or you call them from across the yard, and a dog with pristine recall just stares in the completely wrong direction.
Or they stand at the edge of a darker room, hesitating to step over the threshold.
That hesitation is profound. A dog navigates the world largely through sensory mapping. When the hearing softens or the vision blurs, perhaps from lenticular sclerosis, where the lens of the eye naturally hardens and clouds over time, the world becomes unpredictable and frightening.
So what's the best way to handle that?
The most compassionate response isn't to retrain them, it's to provide environmental predictability. You don't rearrange the living room furniture, you maintain a strict daily routine so they can navigate by memory and habit rather than relying entirely on failing senses.
So what does this all mean when the sun goes down? Because the source material specifically highlights a phenomenon known as the night shift.
Ah, yes, the night shift.
We are talking about nighttime restlessness, pacing the hallways, their sleep architecture completely inverting so they sleep all day and wander all night, or even suddenly having house training accidents.
This raises an important question, and it is a major friction point for owners. When a dog paces all night or soils the rug, humans tend to view it through a behavioral lens.
Like they're acting out.
Right, we assume the dog has forgotten its training or is acting out of spite. But behavioral shifts in a senior dog are almost never a discipline issue. The behavior is the language of distress.
We have to translate that distress. If they are pacing at night, it could be that their arthritic joints hurt too much to settle in one position.
Or it could be canine cognitive dysfunction. essentially dog dementia causing confusion and anxiety as the light fades. That's often called sundowning.
Or a house training accident might simply be a loss of sphincter tone or a urinary tract infection, not a forgotten rule. The behavior is the symptom, not the root cause.
Once we accept that their body and senses are fundamentally altered, we have an obligation to modify the physical environment to support those changes. We have to engineer their world so they don't have to constantly negotiate with it.
The most immediate fix mentioned is covering hard floors with non-slip rugs. And here's why that is so critical. When a giant breed slips, even a micro slip they manage to recover from, they are overcorrecting with muscles that are already degraded.
Right.
A slight splay of the back legs on a hardwood floor creates immense shear force on their joints and can cause micro tears in their cruciate ligaments. You aren't just preventing a catastrophic fall. You are preventing the daily repetitive stress injuries that accelerate their decline.
The same physics apply to their resting areas, too. Orthopedic bedding isn't a luxury upsell, it is a medical device.
Because standard dog beds just flatten out, right?
Exactly. Standard beds compress under 130 pounds, meaning the dog's pressure points are resting directly on the hard floor. High-density orthopedic foam supports the skeletal structure, relieving the shear force on hips and elbows while they sleep.
Combine that with eliminating unnecessary stairs, using rigid ramps for car access to prevent jumping, and maintaining those temperature-controlled zones we discussed earlier.
We are essentially curating a microenvironment where their energy can go toward healing and living, rather than just surviving the layout of our homes.
But all of this engineering brings us to the ultimate, most difficult metric: quality of life. How do we objectively measure that when the decline is a slow, daily fade?
Quality of life for a senior giant breed is defined by how comfortably the dog can still express its core identity. It isn't about whether they can hike 3 miles anymore.
It is about their overall rhythm. Are they resting comfortably? Do they maintain an appetite? Are they still actively seeking out a quiet connection with you in the evenings?
You have to evaluate the macro trend, not isolate one bad Tuesday.
And human memory is incredibly flawed, especially when we are emotionally compromised by watching a pet age. We tend to remember the terrifying night they paced the halls and completely forget the 3 peaceful days that followed.
Which is why the guide strongly advocates for rigorous data tracking to combat this emotional bias. It specifically recommends using a dedicated app called VitalPet.
Using a dedicated tracker like VitalPet really is a game changer for senior care. Instead of relying on gut feelings, you are logging daily metrics.
Right, exact weight fluctuations, meals eaten, water intake, medication times, mobility scores, and sleep disruptions. The interface allows you to graph these data points and visually see the actual slope of the curve over months.
So when you are sitting in the vet's office, you aren't just saying, well, I think he's slowing down. You are pulling up the data trends and saying his mobility score has dropped 20% over 3 weeks, and his nighttime pacing has increased to 4 nights a week.
It transforms you from a stressed owner into an objective medical proxy.
And that objectivity is vital for end-of-life care. When you and your veterinarian are facing the hardest decisions about a dog's remaining time, having concrete data ensures you are making compassionate choices based on the dog's true reality.
Rather than a reactive decision driven by a moment of panic.
It removes the agonizing guesswork from the equation. So, to recap our mission today, we started by dismantling the visual illusions of the giant coat and learning to spot the invisible hesitations in their movement.
We broke down the biomechanics of a shortened stride.
We explored the sudden dangers of heat and cold as their internal furnace fades, and highlighted how hands-on grooming serves as a daily tactile X-ray.
Finally, we look at the vital importance of redesigning our homes to eliminate microinjuries and how tracking data gives us the clarity to make compassionate decisions.
But, we have spent a lot of time analyzing how humans must adapt the physical environment to accommodate the dog's slowing pace.
We have. But it leaves us with a deeper physiological and psychological question to explore on our own. A senior giant breed forces you to move at their careful, deliberate speed. They dictate the rhythm of the household.
Yeah.
How does being forced to adopt that slower, hyper-observant pace fundamentally rewrite your own human neurology and your own relationship with time, patience, and aging?
It is a profound shift. You start out thinking you are modifying your life to carry them through their final years. But you realize they are actually training you to slow down, to observe the microshifts in your own environment, and to appreciate the quiet moments we usually rush past.
That's beautifully said.
There is no simple binary light switch for aging. It is a murky, complex biological process, but if we learn the kinetic language, we can navigate the shadows together. Thank you so much for joining us on this deep dive. Keep questioning, keep learning, and keep diving deep.